Now, the graph in front of you is the graphical representation of the electrical activity of the heart, and that is called as the electrocardiogram. And the machine that we use to get the electrocardiogram is called the electrocardiograph. The details of how it is to be used has been discussed with you in the lecture. So the quick synopsis would include that the electrodes, which are called as the leads, are attached to your right and the left wrist and your left ankle. That is in the case of a standard ECG. Okay. And if you want a more detailed investigation, you can also use leads on the chest of the patient. And a typical electrocardiogram will show the presence of five waves P, Q, R, S, and T, where P wave, it represents the depolarization of the atria by the SA node. The QRS complex is the depolarization of the ventricles, and the T wave is a repolarization of the ventricles. So P wave, when do you get the P wave? The P wave is due to the depolarization of the atria by the sinoatrial node, and it will cause atrial contraction. So P wave, you remember two things. P wave is a depolarization wave due to the depolarization of the atria by the SA node, and it causes later on atrial systole. Impulses go to the AV node. There is an AV nodal silence. That is why you get this straight line over here. Then gives it to the bundle of His that causes the Q wave, which gives it to the apex of the heart that causes the R wave towards the base of the heart that causes the S wave. So QRS waves are due to the depolarization of the ventricles, and subsequently they'll cause the ventricular contraction. तो क्या शॉर्ट में ध्यान में रखेंगे? QRS depolarization waves है. क्यों? तक क्योंकि ventricles क्या हो गए? Depolarize हुए. इसकी वजह से क्या होगा? Ventricles will undergo contraction, that is a systole. The T wave is a repolarization wave. When the walls of the ventricle undergo repolarization, you get the T wave, and the T wave के बाद होगा ventricular diastole. जैसे आपको क्लास में बताया गया है कि इलेक्ट्रिकल एक्टिविटी पहले होती है, मैकेनिकल एक्टिविटी बाद में होती है, जिसकी वजह से द एंड ऑफ द टी वेव मार्क्स द एंड ऑफ द वेंट्रिकुलर सिस्टोल. तो ये एक बात हमको याद रखनी है. So the human heart is myogenic, but can the activity of the heart be controlled? The answer is yes. It can be controlled with the help of the hormones and the nervous system. So in the medulla oblongata, there's a cardiac acceleratory center and a cardiac inhibitory center. The cardiac acceleratory center, through the sympathetic fibers, will act on the SA node, increase the cardiac output. The cardiac inhibitory center, through the parasympathetic nervous system, the vagus nerve, can decrease the rate of heartbeat and the cardiac output. Hormonal में adrenaline can increase the rate of heartbeat. Even thyroxine can increase the rate of heartbeat indirectly, whereas adrenaline increases the heart rate directly by directly acting on the SA node. So even though the human heart is myogenic, the regulation of the cardiac activity is done by the neural and the endocrine systems. The disorders of the circulatory system include as a condition which is called as high blood pressure. When the patient shows the systolic reading of 140 and a diastolic reading of 90 mmHg for a long period of time, it is called as high blood pressure, which can cause brain hemorrhages, blindness, as well as stroke. Angina pectoris is the acute chest pain जो थोड़े वक्त के लिए आता है, chest muscles में आता है, and it spreads over the wall of the chest. Okay, that happens when your heart muscles are not getting enough amount of oxygenated blood. And if your heart muscles are not getting enough amount of oxygenated blood, the condition is called as myocardial infarction. Okay, I'm sorry, when your heart muscles are not getting enough amount of oxygenated blood, it is called myocardial ischemia. And because of myocardial ischemia, you can suffer from a heart attack or a myocardial infarction, where there is sudden death of some of the heart muscles. So that is what is a heart attack. And the difference between a heart attack and a cardiac arrest is when your heart stops beating immediately, it is called as a cardiac arrest. Okay, so a blockage in the conducting system or a major heart attack can result into a cardiac arrest where your heart stops beating immediately. Okay, the deposition of cholesterol and fats, which narrows the lumen of the artery, the coronary artery, is called as atherosclerosis. It's called as atherosclerosis. And atherosclerosis can lead to myocardial ischemia. And myocardial ischemia can lead to myocardial infarction. There's a difference between heart attack and heart failure. जब आपके हार्ट के मसल्स वीक हो जाते हैं और वो इनफ अमाउंट ऑफ ऑक्सीजनेटेड ब्लड पंप नहीं कर पाते, आपकी बॉडी की ऑक्सीजनेटेड ब्लड की डिमांड्स को वो फुलफिल नहीं कर पाते, हम उसको हार्ट फेलियर बोलते हैं. एंड हार्ट अटैक में खुद हार्ट के मसल्स का डेथ होता है बिकॉज उनको इनफ ऑक्सीजनेटेड ब्लड नहीं मिल रहा है. और हार्ट फेलियर में द हार्ट मसल्स are not able to pump out enough amount of oxygenated blood. So you can listen to this again and you can learn it. So that's it for our chapter circulation.